afternoon and thanks for joining us. I'm Judy Simpson. Our focus today is on your health. As part of our ongoing series with the University of Vermont Cancer Center, we're going to learn about a cancer that is largely preventable through education, regular screening, and proper medical follow-up. It is cervical cancer. Although it is one of the most preventable cancers, every year about 12,000 women in the United States are diagnosed with cervical cancer, and about 4,000 will die as a result. Cervical cancer is also the second most common type of cancer among women worldwide. Today I'm joined by two experts who are focused on cervical cancer education, prevention, and screening. Dr. Allison Bolduc is a retired member of the UVM Department of Family Medicine and a former president of the Vermont Academy of Family Physicians. She is also a volunteer leader with the UVM Cancer Center's annual Women's Health and Cancer Conference. Also with me is Allison Hicks. Allison is a cervical cancer survivor, and she is the founder and president of the Hicks Foundation, which is a nonprofit dedicated to eradicating cervical cancer in Vermont. She also serves as the Vermont Legislative Ambassador for the American Cancer Society's Cancer Action Network. Thank you both for coming in. Let's start out by talking about why cervical cancer education is so important and why you're both committed to providing it. Dr. Bolduc, why don't you start?
Sure. Well, thanks for having us. It's a very important topic that is not talked about nearly enough, and we need to really educate the public, also providers, and also our parents. Cervical cancer is diagnosed in a woman every 2 minutes worldwide. It is the cause, as you said, of 4,000 women dying every year of cervical cancer, and it's a cancer that's largely preventable with an HPV vaccine, because we know that human papillomavirus is one of the leading causes of cervical cancer. It is estimated that 93% at least of the cervical cancers could be prevented with the HPV vaccine if it were given to young adults. We also know that that CDC has estimated that 90% of men and 80% of women who are sexually active have been exposed to at least one type of the HPV virus.
Right. Allison, what's your personal experience?
So I was diagnosed with cervical cancer when I was 29, and one of the challenges of that was I didn't expect it. I'd never heard about HPV. I had never been warned about it. Apparently, after the fact, I found out from doctors that they'd known about it for about 10 years. They were aware that there was a relationship to cervical cancer development and dysplasia in the cervix. And, you know, that completely threw me off guard because I had been seeing doctors. I'm educated. I had health care, and I couldn't believe that it had never been discussed before. And so after going through intense treatment and surgeries, I felt like a real injustice had been done and that we should just do more prevention, right? So let's see if we can lower the cancer rate and stop helping with cancer and really work on the causes of that cancer, which would be education to let people know how it's happening.
Right. Dr. Bolduc, what is cervical cancer and what causes it?
Sure. Cervical cancer, the cervix is actually at the lower end of the uterus and is visible when the physician does a gynecologic exam. It is an area at the end of the cervix which is rapidly transforming cells, and we can diagnose that by looking at those cells either visually, but also taking a sample of those cells. So it is,
which is the Pap test.
Which is the Pap test,
right? That's the reason to get the Pap test.
That's right. That's the reason for that screening.
Mm-hmm. And so, tell me a little bit more about the connection between HPV and cancer.
Sure. As I said before, we now know that HPV, the human papillomavirus, causes, excuse me, about 93% of all of the cervical cancers. In addition, it will cause oropharyngeal cancers, which are mouth, throat, neck cancers, as well as penile cancer, anal cancer. So it's not just cervical cancer, although that certainly is a high risk for women.
Mm-hmm. Which also means that men really need to start participating in this education and screening and anything they can do to prevent it and lower your or be more careful with how many partners you have, sexual activity.
It does seem to be on the woman's shoulder.
It totally is on the
is.
woman's
It
shoulder.
is.
There's a stigma about it, but the reality is the number, if you included both men and women, the burden would be on men because there's more 50-50 chance for head, neck, throat cancers. And the reality is it's mostly on men given sexual history.
Are there risk factors for cervical cancer other than HPV?
Well, yes. I mean, certainly
Very
there are
low.
other lifestyle implications. You know, certainly smoking is connected with this. It actually lowers the immune system. It makes the cervix a little bit more susceptible to different viruses. The family history does have some part in it, although not as much. Inconsistent health care is probably one of the biggest ones. Women are not getting screened as much. Diet also can be a factor as well.
Just basic health
It is.
basic
Right.
healthy upkeep and screening would be, regular
Bottom line.
weight and not smoking, things we hear all the time. Anything like that just can feed the virus to grow faster, which is an issue.
So, Allison, what are some of the symptoms of cervical cancer? Is that one of the problems?
Yeah, so the problem is that there's not that many symptoms. Overall, you could be walking around and not really know until perhaps it's pretty late stage. And so for me, I found out because I was hemorrhaging for a few months. And I had talked to my doctors about it, and it took a while to assess why it could be happening. They were, thinking that it was probably an unusual period. I mean, it took a little while, and eventually we, of course, figured it out. But any irregular bleeding or discharge in the vagina, or after sex having any irregular bleeding, prolonged periods, or in my case, just excessive bleeding. And what we found out too is by that time, you're pretty much, 99% have a late growing cancer. So the real risk is if you're not getting your regular screenings, you wouldn't know, and that's would be normal because the screenings are internal and cellular activity is microscopic. So we really need your doctors to be having a good relationship with you and having that regular contact to tell you what's going on.
Talk a little bit about the screening process itself, if you
Sure.
would, Dr. Bowman.
Before I say that, I must also say that the symptoms may not be cancer. They may be something else, but it
True,
really is
true, sorry.
important to speak with your physician if you notice anything that's different.
Okay.
Screening is really very simple. It starts at age 21. It used to be earlier, but now it starts at 21, and it's with a pap smear, which again is just taking a sample of cells from the cervix and sending them off to the lab and getting just to make sure there are no abnormal cells. And if there are, then there's a little bit more frequent screening. At age 30 to 65, we moved to not only the pap smear, but also HPV test as well, which can be done at exactly the same time. And the reason for that is that, as I said before, many people are exposed to HPV, but a lot of them don't go on to they clear it, their system clears it. And it's some people that it stays in their system. And so we don't test it in the 20s, but we do start unless there are abnormal cells. So we do start testing it at age 30. The reason for 65 is the cutoff, and it isn't really a cutoff. There should be screening after that, especially if you've been known to have some abnormal cells, even precancerous cells.
It's based on your doctor's
Right.
recommendation.
Right.
I mean, everything really comes down to that one-on-one relationship with
Right.
your doctor.
Correct.
And as everything will be in flux because you're an individual person, you're special,
Right.
and you have your own needs, and that always needs to be mentioned. But these are just basic guidelines too.
Right.
So I don't want people to think, oh, I'm in this category, so I don't even have to show up for 3 years. That's not the case. You can't determine your own health. You have to see a doctor, and they will tell you if you qualify for that amount of timing in between screenings.
Right. And there are other things that they screen for as well, so it's not just
Yeah,
cervical
it's a
cancer.
wellness exam, a pelvic wellness exam.
Which is not a pleasant experience.
It's
Is that
not.
one of the reasons why some women maybe skip a year, skip a couple years, don't go at all?
Well,
I think
I think the nice thing about it is it's every 3 years now that the recommendation, which makes it a little bit easier for women because before it was every year. So now it's every 3 years. But you're right, it is something that is not looked forward to by many women.
I think
However,
taboo in certain age groups too,
Right.
and hopefully we're growing out of this by this education and practice. There's more women in the field that might make it more comfortable for some women. And excuse me, however.
yeah, no, I agree with that. Yeah.
That it's talked about, we want to make it more comfortable. Ideally, it's talked about before it's happening. No one's just, putting you down in a bed all by yourself saying, put your feet up in the stirrups. I mean, that's old school medicine. There's a basic way to do it. That's the actual process, but there's conversation, there's hand holding.
And so, if diagnosed, what are the treatments for cervical cancer?
So treatment, there's a variety of options based on your the stage of cancer that they diagnosed you with. In my case, it was pretty late stage cancer, basically 2B, whatever. It means it had been already, the tumor had progressed past my cervix into my vagina and into my lymph system, so it had access to my whole entire body. So we had to have aggressive surgery, which led to a radical hysterectomy, which is different than a hysterectomy by the nature of they actually are trying to keep your ovaries to, I was a young woman, and they were hoping that I could still at some time at least have some egg fertility, but I wouldn't be able to carry a child or give birth. And then after that, they found out, they biopsy in the surgery that the lymph nodes, it had transmitted all around the body, and so they did a lot of lymph node dissection. Once I healed from that, which took a while, several weeks, then I started chemo and radiation daily at the same time for, I don't even know, 3 months, a long time.
Right.
The recovery part is almost longer than the treatment part.
Well, let's remind folks how they can be proactive about prevention and detection.
Right, wellness exams are really important. One of the big things that we're pushing now is that we do have a vaccine that really helps prevent this cancer. It is for boys and girls. It's usually given at age 11 and 12.
Why so young?
There is a much more robust immune response and reaction. It's much more effective vaccine if it's given before the age of 14. So we're really trying to target that age group. And the reason also is that they're getting 2 other immunizations at that time, unfortunately for them, but it's the tetanus with pertussis and also the meningococcal vaccine. So it's a time where they're coming in. Those are required by the schools. The HPV is not. Hopefully in the future it may be. But we do have a vaccine that can prevent cancer. And so this is something that we're really trying to educate people around.
The big part of that too is that it's showing to be a bit of a burden for people to come and get. It's a 3-shot series.
Right.
And though the benefit of 1 shot has a benefit because you're getting that in your immune system, you definitely need the 3 shots.
Right.
And so, Vermont is really pushing hard on just immunization education overall. And then cancer prevention equals immunization with the HPV vaccine. And making it affordable, making healthcare pays for it. We know that in the state of Vermont, we've actually worked it out with legislation that it's free for anyone who's 21 and younger if that provider is registered with the state immunization program.
That's correct. I mean, that's really, it's free. It's a free vaccine. There's no charge at all to Vermont primary care doctors who are enrolled in that Vermont immunization program. The state is also doing some outreach as well with education. They're doing office visits to help with monitoring. They're doing quality initiative projects. They're doing quarterly reports to primary care physicians. And also there's a nationwide impetus this year that Vermont is one of 12 states that's enrolled in this. And it's in connection with VCHIP, which is the Vermont Child Health Improvement Program. And it is aimed at education throughout the state and with providers to try to increase the immunization rates and decrease the obstacles.
Allison, how can viewers find out about the Hicks Foundation?
You can go to the website, which you can just write the Hicks Foundation. You can write freepap.org, which is just a freepapsmear.org, because it's an organization. And on that site, you know, it's pretty low tech. We put a lot of our money into free screenings and education. That's our goal, but it will have really good resources, education, links to the health department, CDC, and when we're having free screening days or film screenings for education, we generally put it up there, and any community activities. That's our goal.
I want to thank you both for joining us today. Important information.
Thank you so much.
Yeah, thank you.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.